I'm DJ Manuel, and I am the owner of Emmanuel Business Solutions and webmaster for the Macon County Community Partners Task Force website, which is www.maconcares.org. And today we're having a discussion about COVID-19 and its impact on the K through 12 school system in Macon County, Alabama. And specifically, we are having the honor of interviewing the head nurse for the school system, Ms. Lawanda Gray. In fact, Nurse Gray, I'd like for you to give us, your full title, because I'm always wondering, should I be calling you Dr. Gray or Nurse Gray, or and tell us a little bit about what you do at the school system.
Okay, thank you for this opportunity to talk to you about COVID in our district. My name is Lawanda Gray. I am the lead nurse of the Office of Student Health Services, coordinator of Student Health Services here in Macon County. I've been here for 25 years. This is my 26th year, and it has been a pleasure working with the students and seeing the different dynamics throughout the years of going from the back in the day when it was certain types of flus, and now it's transitioned to COVID. And so I have seen a lot of various things. Right now I'm kind of like the liaison between outside agencies dealing with health services and our school district. um, it's just a lot to deal with, and to I'm dealing with a lot of parents and students and faculty and staff, because they have a lot of questions about various things health related, and I'm their source, and I've trained my staff to be that as well at the various schools.
Awesome, awesome. Then you are definitely the person we want to talk to. And so, Nurse Gray, I know that when this pandemic began, well, before I get to the pandemic, let me just say the National Association of Black Journalists has offered a grant that will allow us to interview individuals and to post articles and videos concerning COVID-19 and its impact on the K through 12 system. There's hasn't been as much information about what's happening in rural communities like ours. And I think that it's important that we tell our story of how we were able to really mitigate some of the COVID problems. For example, our county does not have a hospital. And with us not having a hospital, that posed some great health challenges for parents and students and faculty and staff that were dealing with COVID or trying to address COVID. And so, as it pertains to COVID-19, just going back to when the pandemic first began,
Mhm.
how difficult was it for you to get the right information to be able to communicate to all of those involved, the parents, the staff, and the students?
That is a very good question. When it first, when we first heard about COVID-19, it was it's such uncertainty. Nobody really knew the dynamics, the length, the just it really, it was just all over the place, all the way from CDC to our state public health department to our local public health department. So the resources that I would typically reach out to get information, they would give you information, but they say it's fluent. We really don't know where we're going to be next week, or we don't know what we're going to be doing in the month from now. So what do you do? At that time, Dr. Jacqueline Brooks was our superintendent, and we collaborated. We said, okay, we need a health advisory committee. We came together with Dr. Stafford, our at the time, Mr. Nelson and myself, and a couple of other people. And we said, okay, we have to make sure we have to take care of the students. We got to make sure that they're safe, they're healthy, that we prevent the spread. If they have it, they need to stay at home, just various things that were, discussed. So with that health advisory committee, it was so instrumental. And Dr. Stafford, she was just phenomenal. I mean, she
Now,
had she
remind us of who Dr. Stafford is, if you don't mind me asking.
oh, Stafford is a local physician. Her name is Dana um, Maxwell Stafford. She's right beside Booker T. Washington High School. That's where her office is. But she was, and she does a lot of, I think she had a connection and do some things with the public health department, the state public health department in Montgomery as well. But she was very instrumental in giving us guidance. She knew all of the like statistical things and how we should and should not be doing certain things,
Mhm.
that her knowledge base was so strong, based, a lot stronger than myself, because to be honest, I was in shock. I
Okay.
mean, I was like, this thing is real. I mean, this is something that I can't just grab if you have a little cold, you're gonna grab the student, you're gonna hug them, give them a hug, and send them off. But this was totally different than that. It was major. But with her being on our team, between Dr. Brooks being very savvy and creative and hands-on and talking it out and taking the time to talk everything out and getting input from Dr. Stafford and saying, okay, Nurse Gray, this is what are we doing? This is what the ideal is.
And I want to ask, what do you think is the overall impact of that relationship between those in the community like Dr. Stafford and the school working together?
It is unbelievable. I mean, it is so, I felt so good because I knew that she had the the community. She has an office here in the community, and she had the best interest at heart. I mean, I can call Montgomery and ask the question, but they don't have that connection. You
Mm.
But with her, I could just ask her, and she was genuinely concerned, and she was genuinely wanting to make sure that I had what I needed to articulate what was going on. Or she would say, "No, Nurse Gray, this is how I would handle this. Let's talk about it." Or Dr. Brooks would say, Nurse Gray, we got X, Y, and Z.
Mhm.
Let's what we're gonna, let's pull together. And she would say, okay, I'll do this, you do that, and we will work together, you
Mm.
know. And it was great. And everything clicked because we had all the pieces, and nothing health related would go out without my knowledge, or without discussing it with me, or me saying, okay, this is beyond me, let's get with the health advisory committee. We can call a meeting time. So we get on the phone. Dr. Stafford was always ready and available to assist in any way possible. And Dr. Brooks was always on hand. I mean,
Mhm.
her if she had a special ring for me and us, and we just knew when we called, you pick up the phone because it's something
Right.
going on. That was just
Right.
a stressful time for everybody.
Well, I
And
think
so,
your leadership and making sure that you kept those protocols in place, that you all were going to communicate properly, and the fact
mhm,
that all of the leaders were able to work together, I know that it made a huge difference. And so I want to ask, you mentioned Montgomery, the state capital. You mentioned we were getting different policies from the CDC, different policies from
mhm.
the state of Alabama. What type of measures did your committee have to put together to safeguard the students and the parents and faculty that were beyond what the state and the CDC wanted?
Well, one thing that we did is we knew that we were going to get funding from the CARES Act. We knew that eventually we were going to get funding from ESSA, and you had ESSA 1, 2, and 3. So what I did, and what was suggested by Dr. Brooks, we everything was budgeted out. Okay, of course, when you're getting funds, they're safeguarded. and they want to know that you're using them for the right reasons. So with me in health services, I felt like um, we we really don't have or had not had in the past funds to develop a really nice health clinic. And
Mm.
so my thing was, okay, this is an opportunity for us to make sure that we have a place for healthy children, a place for children that are sick and they can be isolated, also a place that they can be examined to decide on whether or not they're going to be in the healthy area or
Mm.
in the sick area. And then we need a place where they can go out and get with their parents to go home without infecting anybody else if that's the
Wow.
case. So each school, we developed a health clinic. We already had a clinic, but we wanted to make sure that it was equipped with every single thing that's needed. So with those funds, what I did is I got all of our health equipment. Everything was new. I made sure that we had all of our PPE, which is personal equipment for isolation. Made sure that we had at that particular time, you don't want to use the same stuff for each student.
Right.
Now, what we do is in between students, you can just wipe it down, with wipe it down and go on. But we had an opportunity at that time to get isolation gowns. We had an opportunity to get various cleaning equipment, cleaning um, formulas or whatever that would
Mhm.
9.9% will kill viruses and germs and COVID. So we had, otherwise, those funds would not have been there.
Okay.
So we knew that we needed to think through, should we use the same water faucets? No, that's not a good idea. Should we purify the air? Yes, we definitely need to purify the air. What is the criteria when we close down a school? What should we do if we do close down? How would they be taught? That was beyond me. I keep them safe, but once I can't keep them safe and healthy, then and they're home, then how can we get them to learn? Because my job as a lead nurse and my staff is to keep them healthy at school so they can learn.
Right.
But they fell and it's away from me and it's out of my reach, then Dr. Brooks had to step in and say, okay, this is how we're going to make sure that they get what they need. Stepped in. What I did is I went out to make sure that all the students that are medicated, that they have diseases or chronic diseases or whatever, and that I treat or my staff treat at school, are they okay?
Mhm.
So I made house calls, and
Wow.
she her team, they went out and they made sure that those people that were out in the rural areas that had no connectivity, we took buses out with the Wi-Fi's and the internet services and
Mhm.
stuff. I mean, it was an aggressive. It was it was
Yes.
emotional.
Yes. Yes to all of that. But at the same time, I will tell you, I am right now holding back tears when I think about the level of care it took to safeguard all of the children, that you all made house calls, that you checked on those that were chronically ill, that you did all of those things. And it brings to mind, like you said, you're responsible for their health while they're in your care. Well, now that we are, you know, semi back to normal, and I know that the policies are still changing, how do you
Mhm.
see the impact of COVID-19 on your school system going forward?
Well, we've been blessed. I've reached out and UAB have reached out. We have opportunities to have COVID tests.
Mhm.
I requested 6,000 and we went through those 6,000 already. So I requested 8,600. So I have those ready and available. So what I've done is over the Thanksgiving break, I made
Mhm.
sure that every single student in our district to take COVID test home with them and to give them to their family members, and they could test prior to coming back.
Wow. Wow.
Okay. So also I'm reaching out to churches and different organizations to make sure that our community have these. I'm trying to connect with every single resource that I can to make sure that we are on the right path, we're stable, we're doing the things that we can do. I'm training my staff to make sure that they know what to look for and what to do, and that they're knowledgeable of how all of these programs will work so they can talk to parents if they call. Um, so we're just, just trying to make sure at this point that everybody knows we're still not quite there yet, but we're a lot better than we used to be.
Right.
So, mhm.
I just want to close by saying I think with the efforts that you all put forward, as we heard reports from both Dr. Brooks and Dr. Williams, the current superintendent, I think with all of the challenges we have in Macon County, you all have done an exceptional job of
Thank
safeguarding the lives of everyone that's involved, that your influence is not just within the walls of the school, but because you recognize the school as a part of the community, your efforts to help the community as well has been just tremendous. And so, you know, anything that we can say that is good that has happened as a result of the community working together, the Macon County schools are definitely at the center of that work. And just thank you so much for all the work, because we can't quantify how many lives have been saved. We
you.
can't quantify how many of the young people were able to avoid being in a bad situation because of COVID outbreaks in their homes, their neighborhoods, whatever the case may be. But we're thankful for all the work that you have been doing. And I really appreciate you taking the time to do this interview with me.
Well, thank you. I appreciate you inviting me and sharing our story.
Yes,
We
ma'am.
have a lot of stories to tell, but we don't have that much time.